Welcome our viewers of Let's Talk America Radio. Of course, I'm Shayna, on air host and your executive producer, and we are back with another edition of Real Talk, where we spotlight the trending topics you want to know more about, and we always recruit the best and the brightest guests to join us and talk. And today, I'm so excited to be speaking with a world-renowned physician, and we're going to talk about a very important topic. Did you know that January is Cervical Cancer Awareness Month? And what exactly does it mean? There's so many questions that you may have as an adult female at 45 or 50, or if you're 25, or if you happen to be the parent of a 13 or 14-year-old boy or girl, because by now you've probably heard of the vaccine that's out there as well. Of course, we have to start off by saying we're excited to have you in. January is a new year, a new opportunity to be educated on so many different topics. And let me introduce you to my exclusive guest that's going to be with us for the next 15 minutes or so. And she's going to tell us a little bit about herself as well. But the one and only Dr. Dana Cohen is a national renowned internal medicine specialist who has an approach that's very unique. She's treated thousands of patients, listening to her patients about so many different things. And she's so adamant about those medical conditions that matter, that affect so many different families of different cultures, and no matter where you are. Dr. Cohen, I'm excited to have you on the show. Welcome.
Thank you so much for having me.
And super excited to have you on. Now, of course, I did a brief introduction of you. Your CV resume is quite impressive. But we have a tradition here on Rural Talk of Let's Talk America Radio, where we ask our exclusive expert guests, such as yourself, the advocates, what drove you to be where you are today? You're adamant about so many different topics. You want to get the information out about cervical cancer, HPV, all of it. Tell us what really motivates and drives Dr. Cohen. We know your CV is impressive, but for the next minute or so, if you share with us, what got you to this point?
I'm so lucky. I've had incredible mentors in my life. And I think when I found functional and integrative medicine, I knew it was just good medicine. If we could stave things off at an earlier age and teach preventative medicine, which, I think I have a very sort of boutique practice, and I'm allowed the time with patients to be able to listen and hear them. And, so I think it's just good old fashioned medicine. I think
Yeah.
going back to the days when you go and see and you know your doctor, you know your patients, and you spend time with your patients.
Yeah.
So I've been lucky enough to be doing that for over 25 years.
Wow. Awesome. I love that. I love that. It sounds like it's a personal, professional passion of yours. Let's dive right into the topic. I mentioned, of course, that January is Cervical Cancer Awareness Month. I want us to start off with the obvious because we hear about so many different cancers. You know that breast cancer, women getting their mammogram. We hear about colon cancer that's on the rise, and stomach cancer. But when it comes to cervical cancer, I don't want us to overassume that people know exactly what we're talking about. Will you give us in layman terms what is cervical cancer and who does it impact?
Only women have cervixes. So it affects cervical cancer affects only women, and the cervix is the opening to the vaginal canal, the end of the vaginal canal that goes into our fallopian tubes. So it's the end of our vaginal canal. So that's what cervical cancer is. And most cervical cancer is caused by a virus called HPV, human papilloma virus, which is a very virulent, meaning contagious virus. And the truth is, anyone who's been sexually active will be exposed to HPV. So and most HPV is taken care of if we have good, strong, robust immune systems. If our bodies are doing what it's supposed to be doing, then most of the time we take care of this virus and clear it. But there's times when we don't, and that's when it becomes a problem.
So I want to make sure we're breaking this down for an individual woman that's listening at 60 or one that's listening at 38 years old to understand. You're saying that anyone who's been sexually active, right, has been likely exposed to the HPV, that virus, at some point. Is that factual?
Yes.
I
Yes. If
see.
you've ever been sexually active, and it is this is sort of doom and gloom, and I'm sorry to say, but even skin to skin contact, it doesn't have to be mucous membrane contact, skin to skin contact has the possibility of transmitting HPV. So it is extraordinarily virulent, and most of us have been exposed to it. And the good news is that most of us take care of it, our bodies take care of it. But the ones that don't, is the reason why we need to screen for cervical cancer, because it is the number one cause of cervical cancer is HPV and certain strains of HPV.
So you're saying that obviously majority of women or all women that have been sexually active at some point have been exposed to it. But you're saying if you have a healthy or typical immune system, your body's pretty much rid it out in a sense. And so you're saying when you do go for your annual, however often women get their pap smears, it may not come up, but you're definitely saying that doesn't mean you did have not been exposed to it. Your body just sort of, if I will layman's terms, kind of taking care of it on its own.
Yes, and in fact, it does lie dormant until and sometimes when our immune systems are down is when it can sort of rear its ugly
Oh.
head. So I think that's important to note because a lot of times, a 50-year-old woman who's been married for 15 years or something gets HPV and they're like, oh my God, what did my husband do? It's not necessarily that he has been cheating on you. It's possible that you were exposed earlier and it had
Yeah.
lain dormant for so many years.
And Dr. Cohen, we have heard from other viruses that exist, such as HIV and others, that there are things that can be dormant, if I'm right, that may not necessarily show up initially, but can show up to years later. Isn't that true? Not just for HPV or cervical cancer, but other viruses or diseases as well.
Think about shingles. Shingles is chicken pox that lays dormant, and when your immune system is down, it rears its ugly head. Think about that. With shingles, we know that stress is a major cause of shingles. So stress also is a major cause of HPV, or at
Mm.
least one of the things that if you're diagnosed with an abnormal PAP, one of the things that you should really think about is your stress levels. That's a real simple thing to sort of say, okay, I've been diagnosed with HPV. I need to hit this head on. I'm going to start with my stress levels and whatever that may mean. It may mean meditation, yoga, acupuncture, talk
Mhm.
therapy, whatever it is. But that
Yeah.
has to be one of the things that it's important to talk about.
Lifestyle changes. We are putting the spotlight on cervical cancer, HPV, with the one and only world renowned internist. Dr. Dana Cohen is with us, and she's breaking it all down. She did just tell us a reveal, if you do not know, that she's saying that if you are a woman who's ever been sexually active, there's a very high possibility, if not 100%, that you've been exposed to HPV. But if you have a normal or typical immune system, your body has sort of taken care of it. I want to ask this question if someone's thinking it, is it just exposure if it's been intercourse or if it's even oral sex?
Both oral sex and, like I said earlier, skin to skin contact. There's a possibility that that can even transmit HPV. That's how virulent it is. So it's very contagious,
Yeah,
unfortunately, and many of us have been exposed to it. And it's just almost all of us. We don't have those exact numbers, but it's believed that I'm making this number, more than 95% of us will have been exposed to
but
HPV. So yeah.
at some point. And tell us what are some common misconceptions about cervical cancer, HPV? Because one, I think a lot of people will hear the word HPV and say, "Oh, it's automatically cervical cancer." But you already said that majority of cervical cancer cases obviously are triggered with HPV, but that doesn't mean that every case of HPV turns into cervical cancer. Is that a fair assumption?
That is a fair assumption. There's different strains of HPV, and there's ones that in particular that we know to be more of the ones that cause cervical cancer. And then there's ones that cause genital warts. We know that.
Mhm.
Some of the misconceptions I think are important to note is that it can affect women of all ages. It's not just an older woman's cancer, cervical cancer,
Mhm.
right? The other thing is, you have to have had many sexual partners to get
Mm.
HPV. Not true.
Okay.
Um, and that it's not preventable. I think this is important. This is where, my work as an integrative doctor shines. It is preventable, it's detectable, it's treatable when
Nice.
caught early enough. And once again, we said it's directly related to your immune system. So functional
Yeah.
medicine and integrative medicine and lifestyle
Yeah.
medicine, that's where we shine. Because right now, when you're diagnosed with HPV, the only thing you have from your gynecologist is watch and wait. So you get a positive pap smear. All right, well, we're going to repeat that in 3 to 6 months. Let's
Okay.
watch and wait and see what happens. And that's it, you're out the door. So doctors like me, functional medicine doctors, now we step in and say, no, that's not good enough. We have to address this head on. So we start
Nice.
with stress, right? We talked about that.
Okay.
The other thing, I'm going to talk about two other things that I think are super important. If somebody's been diagnosed with cervical, with an abnormal pap that's HPV positive, right?
Okay.
So de-stress, hydration. I wrote a whole book on hydration. It's called Quench, and it is absolutely the first step before you start on any diet, any lifestyle. You have to learn how to hydrate. It is the function and the basis of all
Mhm.
homeostasis in the body. So learn how to hydrate better, always start there.
Nice.
And then I want to talk a little bit about supplementation because that's what I do as a functional medicine doctor. I
Yeah.
talk about nutrients and how to eat right. Also, let me just say something quick. If we're speaking hydration, get rid of the ultra processed foods, eat real
Okay.
food, right? So
Nice.
supplementation, two quick things. Um, there's a medicinal mushroom called AHCC that has human studies backing it up, showing that it clears HPV faster.
Okay.
Great, incredible pot product. I use it also for cold and flu. I use it for cancer, and there's many things. It's an incredible supplement. AHCC.net is its website. You can look at those human studies. The second is folic acid. They've shown that women who are HPV positive, as a whole, have lower levels of folic acid in their body. So you want to
Okay.
replenish folic acid, which is a B vitamin. Very simple thing to do.
And that's a B vitamin. And okay, so
It's
that's something that would help. I've got to ask this, and I'm just going to rewind slightly because I know obviously you're saying HPV is such a serious component when it comes to cervical cancer. You talked about the stress, you talk about making sure you're taking care of your body, your immune system with essential supplements, like you said, folic acid or vitamin D. The other one you mentioned is too ACCG. But I've got to ask, how critical for that woman that's 38 years old listening to you right now, your voice, watching Let's Talk America, how critical is it for her to get those screenings when she goes in and sees a doctor like yourself? And then tell me this: how early is too early to start getting cervical exams, if you will? Because I would imagine if you're not sexually active, I would imagine then the PAP becomes less significant. But I need for you to tell us that. I'm no expert. And then how old is too old for a woman not to be concerned with the PAP smears of the cervical screenings? Help us out.
Yeah. So, first and foremost, I think it is super important to forge a relationship with your gynecologist because everybody's different. And so there may be some women who are 65 who still do need to get pap smears
Okay.
on a fairly regular basis. But most women, they're saying after 65, we don't need to do paps anymore. But it's very dependent. Getting to know your doctor, having them
Okay.
to know you. Screening is critical. It's a silent disease. Cervical cancer and HPV is a silent disease until it becomes a problem. And if you've ever known anybody with cervical cancer, it can be devastating. Screening is super important. I believe I think the age has gone up very recently, but 21, it might have gone up to 25 is when you start screening for cervical cancer.
Okay.
I think PAPS maybe 21 if you're sexually active.
I
Um,
see.
so so there is a time, but everywhere in between, we need to screen. It's super important. And it used to be annually. You mentioned it earlier, annually. That's no longer true. Then it was every other year. That's no longer true. Now it's every 3 to 5 years, depending on your situation, on your history, that kind of thing. So
I
get to know your
see.
doctors, speak to your doctors. It's important.
And like you said, such a great information for us to hold on to. Obviously, this is general information from the one and only Dr. Dana Cohen, who's saying you need to get with your own provider and figure out what works. Because you're right, for some women, it could be every 3 years, but for some women, based on a past or family history, perhaps that gynecologist or internist may want to see them more frequently to make sure they're keeping an eye or monitoring anything that's out there. Speaking of coming in and frequency, and I mentioned family history history. Is cervical cancer, like so many other cancers we hear about, are you at greater risk for it if mom or aunt suffered with it?
I don't think so because it's HPV related. It is so overwhelmingly related to the virus. So I don't believe family history plays a role in cervical cancer.
Okay. And I will say this, like when we have talked about breast cancer or other cancers, sometimes certain families are not very forthright and upcoming anyway with it, right? So some of us don't really know what family history is. So I would imagine in my thinking, empower yourself to be as screened as for many things as possible. So that can be some comfort. And I know you would agree, Dr. Cohen, we've had so many medical experts on that say the earlier you catch anything, the better chance of survival. Is that also true for cervical cancer?
100%. Yes.
Yeah, that makes a difference. I want to talk also about safe sex practices because I know you said if a woman has had any sort of really, even if it's oral or other, you said skin to skin of any type, or even intercourse, she's been exposed at some point to HPV. And let me ask you this: when it comes to safe sex practices, do condoms, does that help with it? Because you did say even skin to skin of some sort puts you at risk, but help us out.
Yeah, sure. It does help. Of course, it helps. It's safe sex is super important with HPV, um, and the skin to skin stuff is it's how do I say this? It's a possibility. It's not, I don't want people to get freaked out and,
Okay.
but it is a possibility. And so it's more to sort of maybe scare you into getting screened.
Yeah. Yeah,
Um,
which
you know,
is important. Which is
yeah,
important.
yeah.
And I want to say this because we are talking to the woman that could be 60 years old as well, that's divorced. But I think a lot of times we push, as you know, society pushes safe sex practices on younger individuals under 30. But talk to us right now how important it is for women of all ages, even that 65-year-old single woman or 78-year-old single woman, to make sure she's also practicing those safe measures.
Yeah. Yeah. I think actually, believe it or not, the older you are, because I think in my generation, mid 50s to mid 60s, we still remember HIV in the 80s. Like we know safe sex has been drilled into us. I think the older women and maybe the younger women are the ones who don't really know about, that when that whole thing sort of that history of
Mhm,
HIV.
mhm.
So safe sex, though, is important at any age. It's just it has to become a part of life. So
Yes.
it's kind of a unfortunately there's it's a no what's the word I'm looking for? It has to be done
Yeah.
at
Yeah.
any age, at every age. And I think the older you are, like women who are maybe have been married for so many years,
Yes.
don't remember, but you need to remember. So if you're going to go out and be sexually active again, you need to practice safe sex. No holds barred.
Yeah, I want to jump back on holistic medicine, which is your area of expertise. You did tell us supplements are important to that. You said stay hydrated. That also helps. And you did mention keep your immune system as up to date as possible. And I'm imagining, Dr. Cohen, that you're also, right, you're preaching to us about keeping up with if you have dyslipidemia, if you're hypertensive, making sure your body, you're taking care of your body, right? You're saying address what needs to be addressed.
Oh, all of those things are important, and I think the functional medicine doctors like myself are the doctors to go to because we're a lot of the time in the information and really talk about diet and lifestyle and all these things that unfortunately most regular doctors don't have the time. They're putting band-aids on these things that are already sort of happening to you or and even there's lots of nutritionists and other caregivers that can really help with these things.
Yeah. I have a very important question for you because we obviously majority of this conversation, which is an empowering, very enlightening one for all of us. And I certainly, again, we love speaking with the one and only Dr. Dana Cohen. She's with us today talking about cervical cancer screenings and some things you can certainly do for your immune system. And she's making sure you get those screenings, identify what needs to be identified with your cervix and other parts of your body. She's very adamant about that. But let's talk about the male role in this because I know we talked about women, we're the only ones that do have a cervix, of course. But when it comes to men, and I say this because I want to transition into that HPV vaccine conversation before we head out, where they're saying obviously young boys, they have talked about it in the pediatrician's office as well. What role do male counterparts have in this? Are there things they can do to help protect their partners? Help us out.
So it's 50-50. This is a sexually transmitted infection. So it comes from both men and women. And men are at risk for certain cancers as well. You mentioned oral cancer, esophageal cancer, anal cancer, rectal cancer. So men also, unfortunately, we don't have a screening test for men. So they have to be a part of the conversation and keep their immune systems boosted. And as far as the HPV vaccine, the recommendation is for boys to get it as well. Um, People ask, is it crucial? And right now, what we do know about it is that it confers a 90% decrease or risk in cervical cancer in women. We don't know what it does yet with esophageal cancer and
I
throat
see.
cancers, um, but but hopefully that information will be coming out soon enough. So
Okay.
yeah, I think it is a two-way street, and it's important
Okay.
for men to be a part of this conversation and speak to their doctors as well, especially if they
With
have a
it.
partner who's positive.
And I want to talk about this as well because this is important. You talked about women practicing safe sex when it comes to HPV or other STD, sexually transmitted diseases. But for that male who has a partner, I don't want to put words in your mouth, but I'm going to assume that as a physician, you're going to say that he also needs to be practicing safe sex as well. I'm imagining so he's not spreading that to anybody, a partner or any other individuals he is having relations with.
Absolutely, yes. And unfortunately, the easiest safe sex is for men to put on a condom.
Yeah.
That's it's just a part of life now.
Yeah, yeah. What do you want someone, and I'm going to focus in on that woman right now, that 40-year-old woman who is listening and watching us right now. What do you want her to know? Because she's busy, right? She may say she has three kids, she's working with a partner, maybe she's by herself doing it. Going to the doctor is one more thing on her list to do, and she's got 1,005, Dr. Cohen. What do you want her to know about her health holistically when it comes to cervical screenings or any other screenings that you hold dear to your heart, being an integrative physician yourself? What should she know when she's busy, she's stressed, she's worn down with homework? What would you tell her to give her words of empowerment when it comes to her physical health, which you and I both know is so, so critical?
Yeah. So you said it earlier, early detection literally saves lives. Cervical cancer is devastating. I've seen it and it's not fun. It's not pretty. It's an awful, awful thing to happen. And if you catch it early enough, it's taken care of simply by a leak procedure or a colposcopy.
Mhm.
And then knowing that boosting your immune system, that kind of thing. So I can't say enough to get that pap smear once every 3 years. Ask your doctor, but that's typically what it is now. And I just want to give out a website because I think this is an incredible, it's the National Breast and Cervical Cancer Early Detection Program. I think you can find it on the CDC. They offer free or low cost services to the uninsured,
Nice.
to people who, underserved women as well, and low income women. So it's the NBCCEDP, National Breast and Cervical Cancer Early Detection Program for
I
those who
love
can't
it.
afford it. But there's services out there for all of us to get screened.
I love it. I love it. And before you leave us, mention those two supplements again for someone that is listening out there, and also explain. I know you said it's great for, can help with cervical health, but can it help our immune system in general?
Yes. AHCC, ahcc.net. You can look at their website. Yes, for cervical cancer, there's human studies on HPV with that, but also for cold and flu, also for COVID and many other things. AHCC is a phenomenal supplement, and folic acid. So folic acid you can find it in any health food store. It's a type of a B vitamin that women with cervical cancer are low in. So replacing folic acid and vitamin C, good old vitamin C is a good thing to sort of help boost your immune system a little bit too.
Build the immune system. Having a holistic physician on, I've got to ask you this. I know you talked about supplements, but when it comes to diet and exercise, how key is that as well?
Always, after hydration, diet, get rid of ultra processed foods, eat real food. That means, just food from nature, more vegetables. Just, I tell people get a salad in with lunch and dinner. Try to do a smoothie a day. If you can't, if you hate salads, then put it in a blender and add some fruit to it. Um, but diet plays a huge role, and exercise. We have to move. Now that can mean many different things for people, but we have to move. So exercise is critical as well.
I love it. Thank you, Dr. Cohen, for being with us here. Let's Talk America Radio. What a crucial and timely conversation. Appreciate all of your help. Of course, as I mentioned before, this is general information by the one and only internist, Dr. Dana Cohen. For more specific information about your history in your own body, please visit your own provider as soon as possible. We got to get those screenings in, not just for mammograms, cervical cancer, also if you're of a certain age, colonoscopies, because as she pointed out so eloquently, the earlier you detect it, the better off you have with survival rates. And you've got to know it to address it. I love it. What a great conversation. Thank you, Dr. Cohen, for being on with us. And I thank you for joining us again for this important conversation, kicking off your year. Again, January is Cervical Cancer Awareness Month or Cervical Health Awareness Month. Make sure you're staying empowered with the latest information and asking those important questions to your provider. Don't wait for them to tell you that you need a cervical screening or a colonoscopy or a mammogram. Be empowered with your own information. For additional information, stay connected to us. We have more info coming your way. Let's Talk America Radio offers real talk for real people, and our video series aims to do that, putting those experts and advocates right in front of you, like the one and only Dr. Dana Cohen. Thanks, Dr. Cohen.
Thank you.
Have a great one, everyone, and stay informed.